Hello, everybody, and thank you for the invitation to present to you all at this conference. My name is Zachary Munn, and it is my pleasure to be presenting to you today about our efforts and my experience with striving for efficient evidence synthesis and guideline development through the use of technology. So by means of introduction and some of my disclosures as well, I am a professor in the School of Public Health at the University of Adelaide and director of a research group called HESRI, Health Evidence Synthesis Recommendations and Impact. I'm also the director of the Adelaide Grade Centre and the past chair of a Guidelines International Network. Myself and my group receive funding for systematic reviews and guidelines, but this comes from government or non-government organisations. We don't work with medical device or pharmaceutical companies. I'm also involved in many methodology groups, and I'm the co-chair of Persist, and I'm funded by the National Health and Medical Research Council here in Australia. If you have any questions about the presentation today, please contact me at zachary.munn@adelaide.edu.au or reach out to me on Twitter or X at @zachmunn. Okay, another disclaimer I should mention, which is of relevance to the presentation today, is that once upon a time, I was also a product developer, and I led the redevelopment of JBI Summary, which was software to support the conduct of systematic reviews. However, I also want to make it clear that I am not an AI or machine learning expert, but I do want to share some of my reflections about the use of tools and software to support evidence synthesis and guideline development after 15 or so years of experience in this field. Okay, so what are we going to discuss today? Let's take a look at evidence synthesis past and present before we get into the future of evidence synthesis. We'll talk about different tools, automation and machine learning in evidence synthesis, and I'll rely heavily on my own experience here. We'll talk about the different tools that people do use and why or why not people actually use these tools. And hopefully we'll touch on workflows and considerations for different types of evidence synthesis projects as well. Okay, so let's go through now the timeline of systematic review. So the first systematic review, as many of you will know or recall, is that James Lind obviously was credited with the first controlled trial, but he also did a systematic review of sorts. In the early 1900s, we found Carl Pearson was the first to statistically combine the results of different studies together. An early precursor of the meta-analysis, which we started to see in the 1970s. Throughout the 1970s and 80s, we started to see more systematic reviews emerge before we saw systematic reviews and evidence-based medicine being introduced in the 1990s and the establishment of groups such as Cochrane, JBI, Grade, and GIN. Moving forward to Prisma, Prospero, and of course, living systematic reviews that we talk about nowadays. So that's a timeline of systematic reviews, but let's have a look at how the timeline of systematic review support tools has also evolved over the years. So really pre-1970s and including 1970s, we were talking about a tool-free era in terms of electronic support tools. Then in the 80s, we started to see reference management software starting to be used, and also the ability to search databases online as well. The first systematic review software that was created was the Cochrane's Review Manager, which was launched in 1994, and JBI Summary was launched in 2002. There was also some statistical software that you could use to support your systematic review. And all of these tools were clunky but beneficial. Now, around the time of 2010 to 2014, there was a lot of discussions about the automation of systematic reviews. And I still remember going to a workshop in about 2010 where I heard about this initiative where there was a group trying to get systematic reviews at the push of a button. And I remember asking Professor Paul Glasio, who was running the workshop, I said, won't this put us all out of a job? And he said, well, potentially if all you do is systematic reviews. But that was now 14 years ago, and I'm glad to say I still have a job in this space, and we're still striving for these systematic reviews at the push of a button. But since that time, there has been an explosion in tools, and many of these tools are catalogued in the systematic review toolbox. And when we get to the modern day, we can see here that the use of automation and systematic review support software is incredibly prevalent when we do any evidence synthesis project. Prisma 2020 talks actually about using automation and the need to mention how you have used automation throughout the various steps in the systematic review process, as you can see here. We also know that Cochrane have launched a policy on AI and the use of AI in Cochrane systematic reviews. And even more recently, we can see this draft guidance about the responsible use of AI in evidence synthesis, which is a collaborative effort being led by James Thomas and colleagues. And if you're interested, you can review those recommendations through the Open Science Framework right now. So it's a very exciting time in evidence synthesis as we start to increase the use of systematic review support tools, AI, and machine learning as well. So I just wanted to touch on why we are actually considering a lot of these different tools. And I'm sure many of you will know this already, but evidence synthesis approaches have exploded over the last 20 or so years, or should I say they've evolved. And nowadays you can do many different types of evidence synthesis projects. And really there's an evidence synthesis approach for any question that may arise in clinical or public health decision making. And you can see that there are many different types even of just systematic reviews, and we've written about this previously. So it's really starting to get a lot more complex. And for each different systematic review or evidence synthesis project, there are also many different steps, and processes that you need to follow. And these are just some of the steps that are included in a systematic review. So you can see that systematic reviews do take up a lot of time. They are quite complex, so that is why we try to rely on these tools to help support the process. We also know there is an abundance of systematic reviews, and we are facing many challenges in this space. There's a lot of redundant reviews, poor quality reviews, poorly reported reviews, reviews that have no impact in practice, potentially because they're taking too long to do. They are costly and time consuming, and many are out of date by the time they are completed. We also see that people use incorrect approaches or methods for the question. Now that we have this explosion in evidence synthesis approaches, there are sometimes people using the wrong approaches, or perhaps not the ideal approaches to answer their actual evidence synthesis question. Now let's talk about guidelines as well. And here you can see this is a summary slide of all of the different, some of the different steps and some of the different tools, standards or checklists that you can rely on when doing a trustworthy guideline. But once again, you can see that the development of trustworthy guidelines has also become increasingly complex as we try to really strive for the best evidence and the most credible and trustworthy processes to inform any clinical, public health or health systems recommendations. And once again, it is a costly and time-consuming process and costs a lot of money to develop a guideline properly, which is why, once again, we are turning to these tools. There is a lack of automation, inefficiencies, redundancies, and duplication of effort. So what is the solution? Well, if you go on Twitter or YouTube or LinkedIn nowadays, you might start to see ads or advertisements or information similar to this, where you can see that you can really do systematic reviews or literature reviews like that. Here's some astonishing tools that we can use to do our evidence synthesis. Here's something else I saw on Twitter, the pathway and process to doing a systematic review. Here was a lecture on AI tools for systematic reviews, and so on and so on. And there is a lot of different, lots of information out there nowadays about how you can use AI or other systems to really automate the process of evidence synthesis and guideline development as well. I would like to say a bit of a warning regarding some of these types of approaches. Yes, these approaches may help you get an answer quickly, and they may also help give you a very or a useful overview of the evidence. However, most of these tools will not really be able to help you conduct a systematic review which adheres to the methodological conduct standards that we need to if we were going to use that evidence to inform trustworthy decision making. So methodological standards and conduct in line with, say, the Cochrane Handbook, or allow you to report a systematic review as transparently as you need to in line with, say, PRISMA standards. So a big warning about some of these advertisements or tools or things that you might see on LinkedIn, Twitter, or YouTube sometimes. Okay, but of course there are tools that we can use, which can help us be more efficient in our processes. And there are some tools that are much more trustworthy than those that we than some of those things that I just showed then. So we've done some work to actually look at the use of systematic review and clinical guideline support tools amongst the community to see why people are using them, why they aren't using them, and what tools they are currently actually using. So here was a survey which was done a few years ago now. It was published in 2021, but I guess in this era of very fast evolution of tools and methods and technology, it's incredibly out of date now. But at least in 2021, you can see these were some of the tools that were being used by the evidence synthesis community, with Covenants, RevMan, Rayan, GradePro, some of the more popular tools that were being used. Why do people use tools? Well, most people use tools because it saves them time, as you can see here. And why would we be using these tools if they didn't save us time? Some people also like to use these tools because they can help improve accuracy as well. And sometimes people are hesitant to use tools because they fear that they will actually reduce accuracy. Well, in this case, most people felt that these tools actually improve the process and the accuracy of a process as well. In terms of factors that prevent people from using these tools, sometimes the learning curve was too steep. It was too hard to learn these new tools. Sometimes there were time constraints and costs. So subscription costs to these tools were also sometimes a barrier. And we did a similar survey, as I mentioned, amongst guideline developers, and these were just some of the tools and systems that were being used back then. But I should mention a caveat to this work is that this was done even a longer time ago than the work with systematic review. So it is very likely to be quite out of date now. But very similarly, some of the reasons were the same. People want to be more efficient. We want to improve collaboration as well. We want to have better records and be more accurate. Okay, so let's start talking about the current evidence base and what tools are out there now, and what has been done or proposed in the past is a different levels of automation to classify the tools that currently exist. So level 1 tools are tools that can improve the file management process. These can be citation databases, reference management software, or systematic review management software. Level 2 tools can enable workflow prioritization, such as prioritization of relevant abstracts. Level 3 tools can actually perform tasks automatically, but potentially unreliably, and require human supervision or otherwise to override the tool's decisions. And then there are level 4 tools that eliminate the need for human participation altogether. In a recent article led by my good colleague Hanan Khalil, we actually looked at many of the different tools that are out there to support scoping reviews and classified them using these different levels of automation. And you can see here that there really are a lot of tools that are out there at the moment that can be used by evidence synthesis teams to support their work. And in fact, a lot of people have published similar articles actually. So here's an article about using AI in systematic reviews. Here's another overview of AI tools. Here's our article. Here's another article. In fact, there is a lot. One of the more recent ones was this article here by Fabiano and colleagues, where they really did a nice um, presented a nice inventory of different tools according to the step of evidence synthesis. And this focused really on AI and showed how and when you could use these different tools in the evidence synthesis process. And you can see here how they all mapped against each other. Now, there is also this report from the European CDC. Just a disclosure, I was a survey participant here and this group did a very large overview of technologies for evidence synthesis. And interestingly, based on their conclusion, they found that really most people aren't using automation or only to a limited extent in their evidence synthesis, which I think is really, really interesting. And more recently, there has been this protocol to look at tools to automate evidence synthesis, which is being developed by ARC, which I think is going to be great because there is too many reviews out there that are looking at these tools. What we actually need is a living systematic review of tools to automate evidence synthesis. So this will provide us with some good information as well. Okay, so then let's talking about guidelines and evidence synthesis as well, and using AI. Many of you may be getting emails such as these, and I get a lot of different emails from different groups who are developing AI or systems or tools to support systematic reviews and guideline development. And to be honest, I've been inundated with all of these different tools. As you can see, there is a lot out there, which leaves us with the question, well, what do we actually use? And it's something that I have to admit I've struggled with. And I've invested a lot of time looking at a lot of these different tools. But a lot of the time, I find that these tools actually don't fit my workflows. Or they have deal breakers within them. For example, you might find that there's a tool which allows you to do some quite amazing things. However, they don't allow you to transparently record or report everything or all the decisions that were made, which once again is a deal breaker when you're trying to do trustworthy evidence synthesis. Or, for example, they only allow you to search, say, PubMed or one database, and then use tools for say, PubMed, which is really useful. But as we know in systematic reviews, we need to do a comprehensive search across databases, and even search for unpublished literature. And if you can't do that using these tools, then once again, it's a deal breaker. So lots of exciting developments, but I think a lot of time, I've personally put in a lot of time looking at a lot of these different tools and almost a little burnt out from looking at them all and then realizing they just don't quite fit with what we need to do for our groups. Okay, and I just wanted to highlight the international collaboration for automation of systematic reviews, who actually provided these Vienna principles, these about how we should actually use these tools and develop these tools as well. And unfortunately, what we're seeing is that some of these tools out there don't actually meet some of these principles. For example, the automation and the software tools don't always facilitate the production of systematic reviews that adhere to high standards for the reporting, conduct, and updating of rigorous reviews. We also see that different groups of different expertise are not collaborating across groups. We're also not seeing that the automation techniques and code is free and available for evaluation. And a lot of these tools haven't actually been formally evaluated as well. So we're seeing so many tools on the market, but they don't necessarily meet these Vienna principles, and it can be a little bit confusing for the end researcher. Now, taking a different view, the choice for an organization to actually start to use a machine learning or AI tool, or even just a new systematic review support tool, is a big one. And we shouldn't underestimate the behavioural and cultural change that may be required when we introduce a new workflow, a new process, or a new tool. So this is why I really like to present this report here from the Norwegian Institute of Public Health, where they actually talk about how you can implement a new tool. They don't talk about a specific tool itself, but they talk about the process of implementing a new tool in an evidence synthesis group and how you can carry this out. And I think if anyone is interested within their organisation to introduce a new process or a new software or a new tool, they should read some of the recommendations from this report, which is all really about how you can do and follow through an implementation process in your organisation. Okay. Alongside this, we found these facilitators when we did our survey, and these can really help, I think, as well when you are actually choosing to implement a tool in your setting. Okay, so I did just want to quickly highlight one of the tools that I think is actually quite trustworthy and really useful, which is Epi Reviewer. And we've been using Epi Reviewer increasingly for some of our review projects. The reason why I'm highlighting Epi Reviewer is because I believe the team who are developing it are quite trustworthy. They know what is required to do high quality evidence synthesis in terms of the conduct and the reporting as well. And when they introduce automation tools, and they do it in a way which I would classify as methodologically rigorous and more trustworthy than perhaps some others. It does have a steep learning curve, but if you are interested in tools, you might want to look at Epi Reviewer. Okay, so where does this leave us in terms of using some of these tools? So these are just some of my reflections here. I think there's a lot of hype, but not sure all the applications actually stack up. And everyone is looking for this easy answer. And some of these developers are actually promoting their solution as an easy answer. But I don't think an easy answer actually exists yet for those of us who want to do rigorous, high quality and transparent evidence synthesis and guideline development. Maybe an easy answer does exist for those who just want to do quick and dirty, rapid reviews or quick and dirty literature reviews. But for those of us who want to do high quality, trustworthy evidence synthesis and guideline development, right now, I don't think there is an easy answer. One day there may be, but not right now. So personally, myself and my team have more trust in tools that are developed by credible evidence synthesis specialist organisations or collaboratives. And these are groups and organisations and tools such as Covidence, where I trust the review to development team, Epi Reviewer, as I mentioned, tools that are coming through the iCESA Next network, the Systematic Review Accelerator, Magic App, Grade Pro, etc. And I also think that these tools are less likely to disappear and more likely to be maintained. I've noticed that some tools, particularly Shiny apps and things like that, which can be used to support the systematic review process, can be really useful and help with a particular step in the systematic review process, but then they disappear or they aren't maintained. So if you have an issue or you run into some trouble, there's no support teams, or there's no way to actually progress because there's no one behind that tool anymore. So I think a lot of these tools will make improvements and save time, but I'm not sure they'll be game changing. I don't know if they'll get us to the point where we can do systematic reviews at the push of a button. At least perhaps not until they incorporate more AI into them, which we'll talk about a little bit later on. So I know this talk is about systematic review software and AI and machine learning, but I just wanted to mention other solutions to help improve efficiency in systematic review and guideline development as well. I don't think we should put all our eggs in the basket of software or AI. So firstly, there is methodological guidance now to how we can do high quality, trustworthy reviews and development of recommendations in a quicker process. And a lot of this guidance builds on an interplay between people, process, and technology. It's not all about the technology, but also people and the process as well. I'll mention this 2-week systematic review initiative where a team from Bond University here in Australia have shown on multiple for multiple projects that a systematic review, a rigorous, high-quality systematic review, is feasible to do in 2 weeks if you dedicate experts with blocked out time and also take advantage of technology. I will say that I think just doing a rapid review or taking shortcuts is not a good solution to being more efficient. And I just wanted to push back on this on this idea of rapid reviews where we can just take shortcuts in the tried and tested systematic review process. And we talked about this article here. Okay, another thing that might save us time is by doing evidence mapping, where we can basically do an evidence map of a whole field or a whole topic or even a whole condition. And then we can use that as a basis for a number of systematic reviews. So if we have these living evidence maps and we continually track the evidence, basically we're just doing one search, one screening and one selection process, and we can have these living curated evidence maps, which could then inform dozens of systematic reviews, thereby being more efficient in the process. There's also, I think, an increasing willingness amongst the evidence synthesis and guideline development community to actually collaborate better. And the Alliance for Living Evidence actually helps create these connections so that we can actually collaborate better and stop duplicating other people's work as well, and actually be more efficient by collaborating and working together. Of course, we also can adopt or adapt the work of others, and ways that we can do this is through grade development or by using these recommendation maps, rec maps, where we can actually identify recommendations quickly and then contextualize them to our own settings. And this is just an example of some work that we did, where we did an evidence map to inform a rapid, trustworthy update of research on the impact of cannabis use during pregnancy. So what we did is we mapped the evidence. We identified all of the potential harms of using cannabis within pregnancy. We identified all of the systematic reviews. We identified all of the primary studies that had been conducted in this field. And then we did targeted updates of those systematic reviews or de novo systematic reviews ourselves. And in this way, we're able to create a systematic review looking at many different outcomes regarding the impact of cannabis in a really efficient manner. Okay. So I'll just quickly touch on some of my workflows. So this is our preferred workflow at the moment for a systematic review of randomized controlled trials. You can see we use RevMan, Summary, or Methods Wizard, which is from the Bond University team, to develop our protocols. Then for searching, we use a polyglot search translator, citation chaser. We can also use cosites, deduplicator, and EndNote. For screening, we prefer using Covenants most of the time. We think Covenants is really simple to use. They also have the RCT classifier, which can save us a lot of time. Extraction and risk of bias, we can use Covenants. Sometimes we might use the dedicated risk of bias Excel spreadsheets as well, but largely we try to do it in Covenants, Analysis, RevMan, and then write up in a Word EndNote, and GradePro for certain your findings. So that's our workflow. For evidence maps and scoping reviews, it's a little bit different. We largely use Epi Reviewer as opposed to Covenants, and then we generate evidence maps in EpiMapper as well. Guidelines is much the same, but to publish the guidelines, we can use Magic App. We can also use GradePro panel voting, which also helps, and other processes, which can also help streamline the guideline development process. Okay, so once again, I'm just going to, there are tools that use AI, and AI, of course, is incredibly popular at the moment. Just some points when using AI, and this is from a slide from James Thomas, who I think is really the guru in this space. When considering a new tool, ask, does it allow you to draw on a sum of all knowledge, or is it using an incomplete or biased picture? Does it enable you to distinguish between reliable and unreliable research? And is a tool itself reliable? Now, people have evaluated ChatGPT for systematic reviews. ChatGPT is continuously evolving, so I think it's getting better and better and better. But at the moment, it still has some limitations. But things like ChatGPT and Claude AI, I think they can be useful for helping with background and discussion ideas. They can help with risk management and project management plans. They can even suggest text for some method sections, particularly for guideline protocols. I think they can give you ideas about risk of bias and extraction and critical appraisal, but I wouldn't say they're trustworthy, but they are quite impressive and increasingly impressive, but I wouldn't use them as a substitute for a human. They may also help with search term generation of search strings. They can help troubleshoot R code if you're using metaphor or something like that for your meta-analysis, and may help with plain language summary as well. But they have improved significantly over time. So the question is, what will they be able to do in the future? So here is just another paper regarding the use of large language models for systematic reviews and focusing on some of the uses and current concerns as well that we've touched on. Okay, so what does the future look like? Well, I think there's never been a better time for automation and evidence synthesis due to open science and reusable data, modern technology, advances in AI, improved tech literacy, the commitment to sharing and collaboration, interoperability and common standards, and the needs of society and the pressures that are coming down on us as evidence synthesis that are forcing us to innovate. However, there's also never been a worse time for automation and evidence synthesis due to the possibility that this might actually contribute to more and more poor quality systematic reviews, including more research waste and creating more, reducing, I guess, the noise to signal ratio, or making that worse. Competition in this space and lots of people trying to sell these different tools. The risk of AI not being adequately addressed, including bias responses and these sorts of things, and hallucinations. Tools appearing and disappearing very suddenly, which makes it very difficult for review teams in our work. And the pressure from society and funders, which may actually lead to shortcuts and worse and lower quality reviews, along with this lack of commitment to common standards. So it's a double-edged sword there. Okay, now some things are going to change though, and of course we're seeing a lot of change. And just recently, you may have heard about this very, very large investment from Wellcome and the UK Research and Innovation, UK Research and Innovation, where they are funding. They're looking to fund new and innovative ways of doing evidence synthesis, which includes using AI and tools and committing to living evidence syntheses. So this could be a game changer in this space. Let's wait and see. But very exciting times. So concluding thoughts, there's no single AI or machine learning software solution yet. I think you need to consider your evidence synthesis type or your guideline and what you're actually doing, and then select from this toolbox of systematic review support tools about what's going to work for you. Don't only consider the technology, consider people and processes, and need to build capacity in your own group and how you might actually embed this technology in your own processes. Consider the coverage of all knowledge of these tools and the credibility of the knowledge. Invest in training and upskilling. Take time testing and refining your workflows. For me, a lot of our improvements in efficiencies have been by reflecting on our workflows and how we can do things better. Consider other approaches as well, such as living, mapping, endowment, updates, etc. And of course, we have come so far. When I started, I used to have to go to the library and photocopy articles. A lot of things were done by hand, flipping through journals, etc. But nowadays, we have so much technology at hand, but we still have a long way to go. So thank you for your time. I hope this has been a useful presentation. I hope you have a wonderful conference. As always, all of our work is about making sure people do the right reviews, the right reasons, using the right methods. Some of our work is, the ways that we do this is through our evidence synthesis taxonomy initiative as well, which you may be interested in and you can contact me about it at any time. Thank you again and enjoy the conference. Thank you.